Hi, I'm Jo Clark, and thanks so much for joining me today. This is the Redefining Midlife podcast, a podcast designed for the 40-plus woman who is determined to challenge society's myths and beliefs around midlife. It's for the woman who is inspired and ready to define midlife her way. Join me each week as I chat to health and wellness experts for up-to-date information on how to live well as some special conversations with incredible everyday women redefining what midlife can look like. Here's to making our next half of life even better than the first. Have you ever found these things happening more frequently? You've got difficulty remembering words and numbers. You're misplacing items. You're having trouble concentrating, perhaps a bit absent-minded, losing your train of thought, being more easily distracted. Maybe you're finding it difficult to switch between tasks. Or perhaps you've just forgotten the reason for doing something, like why you came into a room or why you opened the fridge door. Maybe you're forgetting appointments and events. Now, today's episode is a little different. At the time of recording, it's currently October, and that means it's World Menopause Awareness Month. And the release date of this episode also happens to fall on World Menopause Day. Each year, the International Menopause Society has a theme to raise awareness around a specific topic. And this year, the chosen theme is brain fog and memory difficulties in menopause. Now, even if this does not affect you directly, you're going to be affected indirectly by other midlife women who feature in your life, whether it be family, friends, or perhaps even work colleagues. And knowing more about a topic is also going to help us better understand and become more empathetic with others. And if we suffer from brain fog ourselves, we're going to be more generous to ourselves. Last year, I studied a course created by Australian neuroscientist Dr. Sarah McKay. And in this course, I learned that women's brains grow and change through the various stages of life. So the years of the menopause transition, which can occur for most women from their early 40s and 50s, is another critical period of brain plasticity, similar to infancy, adolescence, and pregnancy. And knowing more about our brain is absolutely key to our health and well-being both now and into the future. The information I'm about to present is coming from reputable scientific sources and organisations. So if you'd like to know a little bit more about this topic, please send me an email or a DM on Instagram, and I'll be happy to forward any links that you're interested in for you. So firstly, what is brain fog? Menopause brain fog is a group of symptoms that happens around the time of the menopause transition. Now keep in mind that this transition can take anywhere from between 2 to 10 or more years. And research studies have found that women's memory does in fact change at menopause. So these complaints are real. It's not just in your imagination. Is it normal? Well, that's a common question that many women ask. Brain fog is both normal and common at midlife. Like all symptoms in this phase of life, there's going to be a wide variation among women. There's no doubting, though, if you experience these problems, they are bothersome and they can affect your quality of life. However, in most cases, they're usually quite mild and they will improve post-menopause. So what causes brain fog? Well, basically, menopause is a neurological transition. The transition into menopause is characterised by rising and falling hormone levels, especially estrogens. So put simply, as your ovaries begin to wind down their duties and head towards retirement, the ovarian brain conversation starts to begin to falter and then it disconnects altogether. And this causes some of those more well-known menopause symptoms like hot flushes, night sweats, sleep disturbances, and mood changes. This is because your brain's estrogen and progesterone receptors that are found in regions that regulate the temperature, sex drive, sleep, emotions, attention, and memory. When you also add the increased stresses of life that many women in their 40s and their 50s experience, like teenagers, empty nest, aging parents with health problems, work and relationship issues, then it can have a negative impact on higher brain function. Many women also become concerned that these memory issues are an early symptom of Alzheimer's disease or dementia. However, these issues are very common in midlife women and they typically improve with time. And all women will go through menopause, but most women won't develop dementia. Dementia at midlife is very rare unless you have a family history of early onset Alzheimer's disease. In fact, the International Menopause Society states that dementia at midlife is very rare, so women should be reassured that memory problems in perimenopause are very common and that they typically get better over time. So given that you can have all of these sort of symptoms happening and you've got all of this disruption to your memory and to your life, you might be wondering if anything can help. Well, the advice from the International Menopause Society is that menopausal hormone therapy, otherwise known as MHT, is the most effective way to treat menopausal symptoms. And treating menopausal symptoms with MHT may actually improve your brain fog. You might be a bit concerned that if you're using MHT to help reduce hot flushes, that you might actually increase your risk for dementia. However, research has shown us that if you're healthy and you start your MHT early in menopause, it appears to be safe for cognition. And if you're using estrogen therapy alone, it seems to be safe even in late menopause for cognitive function. MHT may actually help memory problems, but it's not recommended at any age to treat memory difficulties or prevent cognitive decline or dementia. Treatment with estrogen therapy is advised if you've had an early menopause or your ovaries have been removed, causing a surgical menopause. It's really important that you discuss the risks and benefits of this with your healthcare practitioner. Now, even though we can't change some dementia risk factors like age, female gender, and genetic history, there is good news. It's not all doom and gloom. If you have brain fog at menopause and you're concerned about getting late life dementia, you can postpone or even prevent dementia by staying healthy and implementing daily wellness practices now. Being proactive rather than reactive is key when it comes to protecting your brain. Start working on your health now. Don't wait for symptoms to appear in 10, 20, or 30 years' time because the damage has been done. So things that you can start to do today to improve your brain health and maintain your brain health are things like adding regular movement, eating nutrient-dense foods, staying within a healthy weight range, and setting a goal to lower or maintain your blood pressure to a healthy range. Not smoking and drinking alcohol in moderation, staying socially connected with others, reducing the chemical toxins, implementing good sleep habits, and minimizing stress in your life. In fact, the practices I've just listed form the wellness pillars in my Better Than Before membership. The membership has been designed especially for busy women in this stage of life who are wanting to put the focus back on their health and create wellness habits that reflect their lives and their unique needs, all while being supported as they implement their new practices. So if you're keen to learn more about the membership, send me a message via email or Instagram, or head to my website, www.joeclarkcoaching.com/waitlist. I hope this short episode today has helped you understand the important topic a little bit more and has reassured you that you're not going crazy if you're suffering from brain fog, and that many women are going through exactly the same thing as you. Now, if you suffer from brain fog, remember there's so much we can do to help ourselves. Implementing those daily wellness practices works. But it can only work to a certain point for some women. So if you're concerned or needing more support, then I strongly encourage you to go to your doctor or health provider and have a discussion with them with regards to perhaps going on MHT. If this episode can help another woman that you know, please be a great girlfriend and pass it on. We're all so much better when we support each other. Now, next week, I'm going to have the incredible clinical psychologist, Dr. Sasha Karolenko, joining us on the podcast. You're going to love this episode and chat that I have with Dr. Sasha. Until then, take care. Thanks so much for listening and sharing your time with me today. I'd love you to hit subscribe on Apple Podcast or your favorite podcast app to keep spreading these empowering messages. Please share this podcast with other incredible midlife women in your world. Join me again next week for another redefining midlife conversation. Thanks again for tuning in.